Welcome, everyone, and thank you all very much for your patience. This is a very exciting day for us. We are thrilled to preview World AIDS Day, which is actually tomorrow, by having a voluntary testing and counseling event here. We have invited the entire American Embassy mission staff and the staff of other foreign missions here in Pretoria, both their diplomats and their locally engaged staff. So without further ado, I would like to welcome our ambassador, Donald Gips, who will give you a few remarks about why we're all here today and what this means for us. Thank you.
Thank you, everyone, for coming out today, and I do apologize for being late. I was in a meeting with the health minister talking about the plans for tomorrow. Is going to be filled with major announcements, both by one we will make, but by a number of governments, about a new war against HIV/AIDS in this country. I'd like to welcome our special guests here, my friends from the Diplomatic Corps, as well as the New Start Senior Project Manager, Mariam Imhazo, I'm still learning pronunciation, Right to Care Clinical Director, Tembi Kula, and Chairman Ali Bakr, Ambassador, and all of my friends. I'm not sure all the ambassadors who are here, so rather than going through, I will say all protocol observed. World AIDS Day provides us with the opportunity to recognize the significant strides we have made in the fight against HIV/AIDS over the last 25 years. It also allows us to recommit ourselves to joint efforts with all of our partners to overcome the obstacles and challenges that still stand in our way. Thankfully, on World AIDS Day 2009, the environment in which we are fighting this battle is rapidly changing. There's a renewed commitment and momentum from all the critical players and stakeholders in this multi-pronged effort. Teamwork and partnership are critical components. Together, we can do more. The health minister pointed out something to me in our meeting today. He said, tuberculosis and HIV have figured out how to unite as diseases. Is a country of South Africa and all of its friends do not unite to fight those diseases, we cannot win. It takes a team to defeat this disease. Demand for ARVs has risen dramatically in South Africa as we defeat fear, ignorance, and stigma. Tomorrow I will participate in the World AIDS Day event. Like many others who are personally committed to fight against HIV and AIDS, I'm eager to hear the President Zuma give his inaugural HIV and AIDS address to the nation. Since taking up this job as ambassador about 3 months ago, I've been tremendously impressed with both President Zuma and Health Minister Motsoaledi in their unwavering devotion to battling the scourge of AIDS and winning this war. The United States stands firm in its commitment to support them in this effort. We are focusing our efforts through PEPFAR, the U.S. government program that for the last 5 years has partnered with over 500 South African government and non-governmental organizations to promote prevention, treatment, care, and assistance for HIV/AIDS positive individuals and their communities. Launched in 2003 to combat AIDS, the President's program is the largest commitment in history by any nation to combat a single disease. The American people have provided more than 1.875 trillion rand to the fight against global AIDS. The U.S. government is also the first and largest single contributor to the Global Fund to fight AIDS, tuberculosis, and malaria. In South Africa, which is the largest PEPFAR recipient country, we've committed over 10 billion rand in the last 6 years, and will add another 4.2 billion rand to the cause in 2010. With over 725,000 HIV-positive South Africans now on antiretrovirals, we have much to celebrate. Still, it's very sobering to see that infection rates are not yet going down. The fight must still go on. As PEPFAR goes forward, the United States will support efforts through President Obama's Global Health Initiative to make health systems more responsive to people living with HIV by increasing integration and facilitating their access to healthcare services, including those for TB, malaria, maternal and child health, and family planning. Over the next 5 years, the United States will partner with nations to build the long-term sustainability of their national HIV/AIDS responses. We will support country-led efforts to make universal access a reality for their citizens. America is proud to work with people living with HIV and other partners to boldly address the human rights challenges that drive the HIV/AIDS pandemic. In South Africa, the United States will place a renewed emphasis on assisting the South African government health authorities to build their health service delivery capacity and infrastructure. This includes working with health clinics, doctors, nurses, and community NGOs to assess and build up the skill base in areas where gaps now exist. We will also continue to partner with South African groups that work with places and people most in need in all sectors of South African society, including the prisons, the armed forces, and the rural areas. As the government of South Africa engages international partners, civil society, and NGOs in its new policy of full engagement in the fight against HIV/AIDS, the United States will stand firm as a long-term, steadfast collaborator. We remain firm in our commitment to defeating HIV/AIDS worldwide. Working together, we've begun to turn the tide against this deadly pandemic. Please join me as we do what all responsible people are doing worldwide each and every day, taking the proper medical steps to know our status. Thank you very much.